And today we have two really exciting guests on the show. We have Maria and Carolyn, who's going to introduce themselves shortly. We have a really exciting podcast for you guys today on the topic of endometriosis. And more specifically, we're going to be talking about the very innovative diagnostic test that these two have brought to Canada. Without further ado, if both of you guys could introduce yourselves, tell us a little bit more about your background, and then we'll take it from there.
Great. So I'll start off. My name is Maria Porchelato. I am the CEO with EndoDiagnosis, and I have a background. First of all, I'm over at Fertility Care Calgary, which is a restorative fertility program for women, learning how to cycle chart to understand underlying problems with their fertility that might be in existence. And also I served for 18 years serving the public as a poison specialist. So that is my area that I come from. And over to you, Carolyn.
Hi, I'm Carolyn Plican. I'm COO of EndoDiagnosis. We sort of started this journey last year. We are highly aware of the healthcare gaps for women that exist really worldwide, but they're here in Canada as well. And I'm a fertility awareness instructor. I had many clients who had a big unknown as to their cause of infertility or pelvic pain, period pain. It was brushed under the carpet. This came into my own life with one of my children, and I very seriously started looking for solutions. We have come a long way, and we are really excited to bring forward what we have found and been able to bring up to Canada. Thanks for having us, Shawn.
Thank you so much. Yeah, absolutely. Absolutely. So back to today's topic on endometriosis. So me, myself, I'm not an expert in the field, but as a doctor in the field of holistic medicine, we see patients with all sorts of conditions, including endo. It is something that's quite common that I see in the clinic, and I can give sort of my perspective in terms of what I see, what women tell me about their experience going through endometriosis, their experience going through the whole diagnostic process, through the conventional mainstream route, the challenges that they face, and all that sort of thing. And I can certainly tell you that it seems like there is a major gap in the healthcare system when it comes to diagnosis and treatment for that matter. We see this on a day-to-day basis. We have women that start experiencing unusual symptoms, and it can literally take years before they get any kind of clear answers as far as diagnosis is concerned. Now, obviously, this has huge impacts on quality of life. This has huge impacts sometimes on their ability to work, to parent. There's fertility aspects to this as well. And so it's a pretty serious thing for sure. Now, could you guys give us some more information, first of all, on what is sort of right now today kind of the gold standard when it comes to diagnosis for endometriosis? Can you walk us through a little bit what that process might look like, the current tools that are currently in place? Is this a blood test? Is it a scan? Is it surgical? Like how is it right now in the system? How do women go about to get this diagnosis right now?
Sure. Well, I'll start off. It's quite a long process for women, and it's really frustrating for women. I think as healthcare professionals, we are also very frustrated with how slow it takes. The diagnostic gap right now is at least 5 years. And women see on average about 10 different healthcare practitioners before they achieve an answer or a diagnosis. So it's taking too long. Currently, the process is that you need to go see a specialist. So, well, you would start off with your primary care provider, who would then send you into a specialist. And if the specialist appointment is obtained, which sometimes it isn't, if they don't think it's severe enough or something that would meet the criteria for the appointment, then you might not get in at all. But if you do, then the hope is that you get a surgeon who has the proper skill set to be able to um, operate on the person with a laparoscopic procedure. This is where a little camera goes in. They take a look around and they see up close to the perineum, looking for signs of lesions. They would look around to see if there's something on the uterus, ovaries, diaphragm, liver. They look all over inside. And so this is the current gold standard, the diagnostic laparoscopy. So the wait time while these women are in excruciating pain is far too long. These women do not respond to ibuprofen. Tylenol may be helpful to some degree, but by and large, the treatments that are available are not very effective, and they really need surgical removal. So, so there has to be a better answer, a faster solution, one that is rapid, one that is accurate, one that is non-invasive. And with the medical device with EndoSure, it meets all of those. And this is why it's so exciting, because it is finally something that can help women advocate for themselves. They can find out what is going on with them. It's really step one for those women who are falling through the cracks, who have not been diagnosed yet because they don't believe that their symptoms are related to endometriosis. They don't show anything up on an ultrasound or an MRI, which those two current diagnostic imaging devices, they do not find the stage 1 or maybe even stage 2 endometriosis lesions. It's only the most severe, the 15% of cases, which are identified on ultrasound or MRI. So we're really limited in our diagnostic capabilities right now.
Yeah, no, absolutely. And I mean, I had a case this week. Even this is a woman that's been struggling symptomatically now for at least 5 years, maybe more, kind of thing. And just to kind of the point you mentioned earlier, one of the biggest struggles she has so far, she hasn't been able to see a specialist yet. Part of which was, from what she's kind of told me, the doctor says, you don't meet the criteria. And I'm not sure personally what those criteria are, but she doesn't meet the criteria to get that referral to the specialist to take things to the next step, right? In the meantime, she's been on several leaves, long-term leaves from work because of crippling pain, right? Can you tell us a bit more, like, why is it so difficult for women to go from the family doctor to even get a referral to the specialist? Do you know a little bit, as to why that's so difficult, why there's so much, why that's such a barrier to kind of take that next step?
Yeah. Let me answer this one, Maria. I think there's two things. First of all, women's menstrual pain is normalized. And so
Hmm.
young girls are taught periods are painful. And even if they go from initially being able to manage the pain, if they have endometriosis, that pain increases in intensity over time. But because it's normalized for many years, they may not even bring it to their family doctor. They may
Right.
not tell their parents. I'm talking young teenagers, as young as 8 or 9, maybe if they've started menstruating early, this is when it begins. So that's the first barrier, is lack of education and normalization of this suffering of women. And number two is their family physician he may have normalized women's period pain. And so it's now
Yeah.
they've brought it, it's bad enough that they brought it to their clinician. It's normalized at the clinical level. And as a fertility instructor, one of the things I always told my clients is you need to chart things. And so there's many ways to chart so that you can record things that maybe you would rather forget. And pain is one of those things where, you're at a level 10 pain in the first day and a half of your period, for instance. So you could chart how much over-the-counter pain medication you've taken. You can chart your level of pain, where it was located, the type of pain it is. You can also chart how heavy your period was. And now with a cup, so there's a menstrual cup that women can use. Often women are really menstruating heavily, and for, over 5 days, maybe 7 or 8 days when they have endometriosis, they can measure that now. And so we're going to get a much better handle on, hey, do you have very heavy menstruation? So these are things that women can chart if they're able to express to their clinicians the level of pain that they're in and for how long, and then also how that affects, how that affects their life. I missed work for 3 to 4 days. I missed school. I am no longer participating in sports, or I am not able to participate during specific times of my month. The more you can communicate that to your clinician, the more they will elevate it to say, we do need to send you to a specialist. So it's self-advocacy and education that women need, that this is not normal. They have to be very truthful about how painful this is and how they're struggling through it, because we all know stories working with patients or with clients who have strategies to deal with all of these, and they don't tell their clinician that maybe they're bleeding so heavily they're using 2 types of protection. So they're using a tampon and a pad and they're changing that every hour, both of them. The doctor doesn't know that, but he has to know that. Also ways of, okay, I'm starting to take medications before my period because it's so bad, and then I'm overdosing. I don't recommend this, by the way, but the doctor needs to know that. And so that is a huge barrier for women, because it's a lot of it is not being able to talk about it. And there's no talking from a parent to their child about it. And so there's no tools, there's no words for women to express this to their doctor, but there are tools now. The other thing is there's just a lack of resources. There's a lack of resources in terms of the number of specialists in Canada. They have huge wait lists. And then a lot of things that the family physician probably could do, they defer that to a gynecologist. And so you have to wait for a long period of time to get in with them. So that is part of it. And we have Maria and I know through talking to others in the infrastructure that there's just not enough gynecologists, and they in the public healthcare system, they actually have trouble running. There's not enough funding through the public system to give proper care. I don't want to really go beyond that, but
No, for sure.
reports on this
Yep.
of
And
the inequities, basically, of funding provided.
Absolutely.
and moreover, Shawn, the other problem is that, as Carolyn touched on, the gynecologist can't take on this load. They have to defer it to other healthcare professionals who are out there, who are more available, more accessible, who can deal with this. And, we talk about having a team approach within healthcare. This is where the team approach comes in. Kinesiologists, physiotherapists, people like yourself, pharmacists, we all have advanced practice opportunities. We can take the load off of the specialists. It's, even if you can take it to primary care providers, that is important, but Ontario is really struggling with primary care providers right now, for example. Nurse practitioners are another great resource. And the government is looking at opening up those opportunities for them. So we need an all hands on deck approach here. We can do this. We can help these women if we have the will to do so. And it is about spreading out the help. and allowing them to go to the places and help themselves. There are things that they can do. Women can advocate for themselves, and we are, Carolyn and I, as mothers of daughters who have struggled with endometriosis, we are not only involved with a medical device that can help women with endometriosis, but we are patient advocates. So just like yourself, we are acting in several different ways.
Yeah, absolutely. I mean, that was an incredible response there. I think that's going to bring to light some of the key issues at hand here. Like one, as you said, there's like the normalization of some of these symptoms, and so it's just kind of getting glossed over, and it's just sort of like, toughen up. Like, that's just, you're a woman. That's just what it is. Like, I think women understanding that, to recognize when it's not normal. And to advocate for themselves, to learn, to get the education, to find the words that they need to use, to find the kind of metrics that they can track on their own and bring that information to their doctor. Those are all incredibly important points that you guys brought up there. That's very excellent. On the diagnostic front, you did a great job at explaining the different ways, that there's different tools, that are used in diagnosing endometriosis. When it comes to, and I understand, how probably ultrasound and some of these tools can, miss stuff, right? Because, with a lot of conditions, these are tools that sometimes you can't get the clearest picture. Why do you think, even with, let's say, a laparoscopic approach, because it is to my understanding, and I've seen this a lot with women, that they went through that process, and even after the first time that they had a laparoscopic kind of diagnostic assessment, it wasn't found, even though it was really there. And sometimes it took 2 or 3 kind of tests before it was found. And at that point, it had gotten worse even. Um, why is it, even with laparoscopy, why is it that sometimes women are still getting misdiagnosed?
Yes, that's a great question. And the the short answer to that is that there are different skill sets within surgery. So originally, there was a lot of ablation surgery that was done where visually these surgeons were taking a overall look at the pelvic cavity inside. If they saw things that they thought could be endometriosis, they were essentially burned off. This led to a lot of problems with scar tissue development. So in the United States, decades ago, there is a pelvic plastic surgery specialty that developed in order to help women with gynecological issues like endometriosis. And what they developed was what they call a near contact laparoscopy, meaning that you come up close within 1 centimeter of the perineal tissue, and you take a very close look around, but there's a procedure in the way that they actually look within the pelvic cavity. They follow a very specific process in how they take a look around. So what it comes down to is having the proper skill set within a surgeon, and there are different levels. So you have your, your OB-GYNs. Then above that, you may have your MIG surgeons, the minimally invasive gynecologists. But then above that, you have the pelvioplastic surgeons who take it to another level. So I think a lot of it is skill. They're unable to identify the lesions that are there. They may not have the adequate training in recognizing them. Oftentimes there can be these hemosiderin deposits that are in the perineum that are misunderstood to be endometriosis lesions. They're not. They're actually from the leaky cysts from endometriosis that are depositing. So if you don't understand what you're looking for, you're going to run into trouble, and you're going to do more damage or more harm than good. So it comes down to education and training of the healthcare professionals or surgeons that are doing it. And so surgery is certainly one of the ways that we can diagnose. What we're proposing is that we look at all of the different ways of diagnosing. We're looking at the ultrasound, we're looking at the surgery, the MRIs, but also the very first step can be this very minimally invasive endometriosis test with EndoSure, that it just helps identify, is it there or not? Yes or no? If it is, then it helps us to understand what is the next step in the process. Who is the healthcare professional who is best to go to next? Maybe they don't have endometriosis at all, and they are unnecessarily clogging up the system.
Right.
So, thank you for bringing up this surgical
Yeah. Yeah.
way of addressing endometriosis, because it's not as simple as it sounds. And
Yeah.
perhaps some women out there think, oh, I just need to go into surgery. Well, why take the risk? If you don't need to, there are other things we can do, other steps we can take.
Yeah.
It's a stepwise approach, really.
Yeah, for sure. Because one, it's minimizing risk, which is always key in medicine across the board. Anytime you're using a surgical procedure, we're upping things in terms of invasiveness. And then two, um, there's a lot of women that go for the laparoscopy. Um, they don't get a diagnosis, and then they feel quite hopeless because they feel like that was the definitive kind of answer, right? That medicine had to offer them, right? And so if nothing was found, they're just now living with this pain,
Yeah.
and they're even more dismissed from their family physicians or whatever, right? And then there's a whole lot more gaslighting going on, and it's really, it takes the problem to a whole other level, and it takes a huge mental toll as well, right?
Shawn,
So
could I quickly follow up on that question, like Maria's
yeah,
answer? The
absolutely.
actual statistics are they get it right with laparoscopy 50 to 75% of the time. That's
Wow.
not that good, and
Wow.
it depends on skill
No.
of the
No.
surgeon. So that's number
Yes.
one. And
Yeah.
number two, 85% of women with endometriosis have what's called peritoneal category disease. So they're flat lesions that are sort of scattered over the peritoneum. They can't
Right.
be picked up easily unless they're quite a bit bigger and they're at a higher stage. It's not until you have an endometrioma, so endometriosis, and it can get quite large in the ovary, or you have deep infiltrating endometriosis where it's invaded uh, into adjacent structures, like into the bowel, etc. Um, that's when they can
Yeah.
start seeing things, and so those are easier to see. I don't think it's easy to see yeah, at any phase, but yeah, that's why what we're bringing forward is really important. It doesn't what we are bringing forward, it doesn't detect where the endometriosis is. It just detects if there's endometriosis or not. And so
Right.
it helps it really eliminate unnecessary surgeries if there's no detection of
Right.
endometriosis. Then you know that there's other investigations that need to continue. Um,
Yeah.
and if it is detected, then you need a high level of care. But also, we're hoping that this will bump treatment up. So treatment is accessed
Sure.
more quickly. So disease does not develop to these catastrophic levels where you need a 10-hour surgery. That
Right.
includes a bowel resection, for instance. Now, this is just
Right.
one type. There's many types of endometriosis. So the idea is to catch it even when girls are teens, as
Yeah.
opposed to
Yeah.
letting it continue for 20 years. And this happens in
Right.
Canada, where it's not detected, it's not diagnosed, and it's not treated until it's far more advanced. Yeah. Sorry, keep
Yeah.
going, keep
Yeah.
going.
Yeah.
I
No.
wanted to throw
No. No.
that
That
in.
was excellent, and I'm really glad you brought up that statistic, because on the one hand, it's worrisome that there's, up until now at least, haven't been a better way, right? I think you mentioned 50 to 70% or so.
Yeah.
Um, I mean, that's a huge gap. That's a huge gap, right? And I hope that reassures in a sense, many women who have gone through the process and have been told there's nothing there, to know that, like that probably wasn't definitive, right? And you know your body best. And if you don't feel right, that wasn't a final determination, as to whether or not you had endometriosis. And there could still be more that can be done here to figure things out for you. Which takes me into my next question. So far, you guys have been alluding to some of the kind of benefits that EndoSure and the technology, has. I want you guys now to kind of go all in here, explain to us very specifically, what is this technology? What does it look like? Give us the meat of it.
Maria, do you want to go ahead?
So the EndoSure test is something that is really quite revolutionary. It's not something that just came out a few months ago. It's been around for some time, and actually the knowledge behind the mechanism of how it works has been known since 1998. So it goes back a ways. The EndoSure test is really a way of identifying if endometriosis is present or not, based on the myoelectrical activity in the gastrointestinal system. And
what is that specifically?
so it's a biomarker, in fact, the gastrointestinal myoelectric activity biomarker. So when endometriosis is within the body, wherever it is, it could be in any location within the body, as I mentioned, liver, diaphragm, bowels, uterus, ovaries, perineal area. These endometriosis lesions produce prostaglandins, two specific types, the prostaglandin E2 and the prostaglandin F alpha.
Yeah.
And these two neurotransmitters, when they are present in very high amounts, and which they are in endometriosis, they're in excessively high amounts. And one of the things that they create is a spasm or seizure-like activity within the small bowel. And when you are able to measure this, is similar to, say, an ECG, when people get their heart monitored and they put the pads on and they are monitoring the electrical activity of the heart. Well, the EndoSure medical device uses a similar process. The pads go on the abdomen, and through these pads, you can pick up these electrical signals, which are very specific to endometriosis and are caused in the small bowel. And if you can pick those up through this device, then it helps you identify if there is endometriosis or not. And like I mentioned, there is a fingerprint that is very specific to endometriosis only. It's they screened out other disease processes such as gallbladder disease or celiac disease, those types of things that could also cause discomfort or could raise the prostaglandins or cause spasms in the abdominal area. They did rule those out. And so with research, they were able to identify very specifically these frequencies that occur. And so that's what the machine identifies, and it provides you with a yes or no. Do you have it? There is an activity index, which gives an idea of how active the disease is in there, but it certainly doesn't stage it, at least not at this point. But it does give an activity of the disease. So with this in mind, it certainly helps as being the first step in understanding if endometriosis is present. We're not saying it's the only step in endometriosis diagnosis. There are other ways, but if you can identify with this technology that endometriosis is there or not, you can very quickly start up treatment in order to cause regression of the disease. So maybe they're waiting for surgery. Maybe it's a year or two for them to get into surgery, but at least the disease is not going to advance 1 or 2 years more because you know what you're dealing with. You can make an accurate treatment plan for them. You're giving them the drug of choice. So we know that a lot of doctors or pharmacists would prescribe the birth control pill, for example, in women who have that um, uh, secondary dysmenorrhea, which is this excruciating pain that they're feeling. But the plain birth control, I should say, a combined contraceptive product is not the best choice for drugs. You would want to look at some of the other options out there that are more progesterone or progestin based that actually cause regression of the disease. So that's why step one with this test is vital in starting that pathway to care.
Yeah, no, that's incredible. So, like how you kind of described it a little bit for those who are kind of trying to visualize what this test looks like, kind of like an ECG, where you have these pads that are just kind of placed, in this case, over the abdomen, and just picking up on electrical signals coming from the muscles in the bowel tissue, um, and giving an indication as to this unique biomarker that you mentioned that is only present in endometriosis, no matter where that endometriosis might be in the system. So that's quite incredible. Could you comment a little bit on, let's say, the accuracy of the test? Because we mentioned before the current gold standard, 50 to 70%. What about this one? When someone's going to get this kind of test here, what is the accuracy in identifying this biomarker?
Yeah. So the accuracy, we divide it by age, 35 and under, and this test can be done at any age, so even young teens.
Okay.
Okay.
Oh, okay.
It's
Okay. Very good.
99.87% accurate is
Wow.
the pivotal trial results. The
Wow.
selectivity is it's 95% selective and 96% specific. And so what that means is not only is it almost 100% accurate, but
Yeah.
that
Yeah.
if it says you do not have the disease, it's 96% that you don't have it
Wow.
statistically, and then 95% that you do have it if it says that you have it. Now
Right.
the pivotal, so if you're 36 and over, it's a little bit less. They've never had in their trial, they didn't have any incorrect readings. Every person without
Right.
endometriosis did not have it, had a GEMA biomarker that indicated or detected no disease. Anyone who had endometriosis that they knew had the disease, it was detected. And then there was also a cohort where they didn't know, they were going in for surgery. They didn't know whether they had endometriosis or not. And so all the surgically verified findings out of that 49 people in cohort 3 of this pivotal study, the 47 that the test detected endometriosis in all had endometriosis, and the 2 out of 49 that it detected no endometriosis on laparoscopic biopsy, no endometriosis. So,
Wow.
but let's just do, so 36 and over, they noticed the statistically that they would expect 98% accuracy, so down 1%, and
Yeah.
selective 91% of the time, and specific 95%. So you lose one
Wow.
percentage there. So it's
Wow.
a significant jump. In terms of this test, it takes tip to tail less than an hour to do. There's
Oh
really
my goodness.
30 minutes of active scanning, but there's a little bit of preparation, including a water load. And the water load means what the patient does is drink water. And that's
Right.
what starts the activity. And then the
Right. Yeah.
device just listens to that electrical activity and collects the information. It's objective. The results are immediate. So as soon as that 30-minute active listening phase is done, you have your result. It's a printout, very, very
Wow.
simple. And to prepare, you need to fast for 8 hours before from food and water, and you don't drink coffee and stimulants that day. And then uh, the 2 and 3 days before, you avoid medications that affect your stomach.
Right.
So antispasmodics and pain medication.
Yeah.
And
Yeah.
you don't go in on your period. That's it. It's so easy to do, but
Yeah.
it's the what you get from the test is an unbelievable amount of information for yourself and for the clinician and for your clinician. Like the results are brought back
Yeah.
to your doctor or whoever's treating you. But actually, the one thing I do want to say is there are, I think, 6 now trials that are going on to go, okay, here the pivotal research was published. Now we want to see in our center if this
Right.
is holding true. Is it this 99%
Yeah.
accuracy? And we have the
Right.
interim results from one of those studies published, and it's showing
Mhm.
100% accuracy.
Wow.
Okay,
Wow.
so we'll see the other challenge trials. There's
Yeah.
one going
Yeah.
on at Sheba Hospital in Israel. That's one of the top 7
Mhm.
centers in the world. There's one in the
Wow.
States. There's it's happening in the UK. It's happening in South America. Like we'll just see more and more. Probably every country will end up um, looking, hey, is this too good to be true? Because 99.87% is pretty accurate. And
Yeah. No, that's very high.
right
That's very
now,
high.
all of the studies are corroborating the pivotal research. And I do expect that to continue because it's an objective measure.
Yeah, no, that's absolutely incredible. That's incredible. That's it's such a huge game changer to hear
Mhm,
about this
mhm,
technology.
mhm. Yep.
It's and it's so innovative too, right? Um, in holistic medicine, we always when people come in, we have a very strong philosophy of not just focusing on where the symptoms being experienced or where the problem seems to be, we're looking at the whole body. We're looking for signs and things that can be viewed from a systemic point of view. So even the idea of looking at a measurement in the bowel for something that's
Mhm,
often kind of considered to be, affecting the reproductive organs and so on, is just, such an innovative thought to do that. And I mean, the benefits are just, I can't think of anything better as far as like a diagnostic tool, something that's non-invasive, that's relatively
mhm.
fast, that can be used at any age. It's just it's so incredible. Uh, Now, my understanding is that it's already Health Canada approved. Is that correct?
It has been,
Yes, that's correct. It's
yeah, since
Yeah,
December
it's
of
already
2021
since. Oh wow, excellent.
yeah.
for
And
the
so,
indication of diagnosing endometriosis, by the way, just to clarify.
okay,
Yeah.
and right, right,
Yes,
amazing.
yes, it's very specific for that. It's also a non-active test. So it's just listening to the electrical activity within the gut. You don't have to undress. You're just placing the pads on the abdominal area. I agree with you, Shawn. It is really a clinician's dream to have
Yeah,
such a simple harmless device that is used that really you can train any office staff to administer or perform.
yeah,
Um, the interpretation of it is a different matter,
right.
but it's really not much different than a pregnancy test, a urine pregnancy test, where you go, you pee on a stick and it gives you a positive or negative.
Yeah,
This
yeah,
is
yeah,
not a whole lot different. You get a positive or a negative. There's no need to say, well, maybe it is, maybe it isn't. No, it's definitive. And then you take it to the next step,
that's
whichever that might be.
yeah, that's absolutely incredible. Now, today is in Canada. Where can women go and get this test done? Because I know as soon as people listen to this episode, um, they're going to want to know, like, okay, where is this available? Do I talk to my doctor about this? Like, what does a woman need to do to get access to this test right now?
Okay, so we are working so hard to get this in front of clinicians. They're really hard to get in front of. We're also we are looking for diagnostic centers, private clinics, doctors' offices, gynecologists who would want to have this test within their center. We do have to have a center that has a responsible provider. So that has to be a physician who's then able to take these results and move people down to the next step. So it has to be within a
Hmm.
center like that.
Yeah.
But the biggest thing that women can do right now, go to our website, endodiagnosis.com, and put your name on the wait list. The wait list is just a tool that we're using for advocacy, so we can tell clinicians, we'll never give them your information, but we will say, this is how many women are waiting for this test to become available in Canada. It's been here for a long time, but no one is carrying it. And we're asking the healthcare system to open up a little bit and at least provide access minimally to women. So far, we're working, but we're hoping March, this endometriosis awareness month, we'll at least get this into a few centers. I'm hoping somewhere in Ontario, because so many women from Ontario have come to us, and certainly somewhere in Western Canada. But the need is desperate for women,
Yes.
so they can advocate for themselves. If you put your name on that wait list, we will not market to you, but we will tell you whenever a clinic opens up that carries this, and then you can decide for
That's
yourself
right.
whether you want to go. Is it close enough? Can I get myself there? But we're really working hard, but more than
Yeah.
full time, believe me. And
Mhm. Yeah.
also with women, if they can bring this to their family physician and spread the word about it, that's a way to advocate to get this in. So we have a flyer for clinicians. You can download it off our website and bring it to your doctor and say, I want access to this. The more doctors who know about this and demand it, that's how we can get it into diagnostic centers. When there's demand and advocacy, we can get it in. Okay, so that we are not powerless, but if we all work together, we can get this, we can make this available in Canada. It's already authorized to be here and to be done. We just have to, with one voice, push forward. And I'm hoping that will happen in March 2025, where women raise their voice and say, I want to know. I want to know now whether I have endometriosis, and I want the power of diagnosis back in my hands. Then it will move our healthcare system ahead, by leaps and bounds. It's
Yes.
pivotal. It's completely, it changes the dynamic for them.
And further to what you said, Carolyn, just about responsible provider, I know that physicians are the primary care provider for that person, but there are other healthcare professionals out there who do have it in their scope of practice to take the EndoSure results and deal with them. So nurse practitioners are a great resource. They are becoming more and more available. Perhaps uh, uh, pharmacists, physician assistants, chiropractors. Really,
Osteopaths.
it's whatever is within their scope of practice. Physiotherapists, I'm not sure about yet, but we just the responsible provider, if we can expand that and make sure that we're utilizing and allowing the accessibility to occur for patients, these are all key factors in making it available.
Absolutely, absolutely, and like you guys said before, this is going to take a team effort, and we know the public health system is often overwhelmed, and I mean, we hear that story all the time, but we have to kind of work at this as a team and like make
Yeah.
use of everyone's skill set, so we can start getting these women answers quicker. and start working on treatment strategies quicker as well, right? And the quicker they get answers and things, the quicker we can find solutions and get them better, right?
Yes, absolutely. Early diagnosis means early treatment and regression of the disease. We have to treat this benign gynecological disorder as actually like it is cancer.
Yeah, yeah,
And that's what Dr. Matthew Leonardi did speak about, who he is an endometriosis specialist and surgeon. And he said it's about time, because if, even though it's benign, it can proceed over time to becoming something that is so severe. And then that's when you run into trouble and you have these really long surgeries and very complex treatment plans for these
oh yeah,
people. We don't need to let it get that far.
yeah,
We
yeah,
can do step one with a diagnostic test and then take it from there.
absolutely.
It's about preventative health. And Shawn, I know that in your line of work, as you said, it's holistic, it's long-term health, it's preventative health. This is where uh, this this is where EndoSure comes in. This is where our care for women, it's this is essential.
Absolutely, absolutely. And on that note, I'm going to kind of segue into my world a little bit and just kind of talk a little bit about sort of the holistic approaches that we take with women with endometriosis. Um, for anyone who's listening, and I know a lot of people who are going to listen are very much interested in natural approaches and holistic approaches. One of the benefits of which is you can start at any time. All right, whether you have a diagnosis or not, all of the kind of tools and recommendations we have in holistic medicine are suitable to do at any time. You don't have to wait, until you've reached a diagnosis or anything like that. You can start whenever. Prevention is number one. The kind of tools and things that we recommend work well preventatively. They work well at any stage of the process. So, um, you know, I'm going to start with a couple of just like anecdotal stories of some cases that I've had, and it was kind of these types of things that brought to my attention how powerful holistic medicine can be with stuff like this. As I said, I'm not a clinic that specializes strictly with endometriosis, right? We see a whole plethora of things. When I did my PhD, it was on the subject of chronic pain, and we took 5 very different chronic pain conditions, everything from migraines and headaches to eczema, psoriasis, skin conditions, to IBS and inflammatory bowel disease, to chronic back pain, arthritic conditions, and all sorts of things. So we see a whole wide spectrum of conditions. But what we found in even all of those chronic pain conditions, and I mean, endometriosis could easily be kind of put in that category as well, is they all had similar underlying root causes. Okay. And I like to kind of group them up as into 5 kind of pillars, if you will, or 5 root causes. Um, and I also have a series of talks that I did on that subject called the 5 root causes of disease, which are available on my website free of charge for anyone who's interested. But I'll give you the 5 root causes because it'll get you to start thinking about the things that you need to start doing to start improving your overall wellness and your health. And these are the factors that can make a huge difference. Now, going back to some of those anecdotal cases, I had a woman who had been bleeding daily for several years. And she, again, it was part of that case. No one knew what was wrong with her. It was taking forever. I mean, even all those years, they still didn't have an answer as to why that was happening. They threw around the term endometriosis. They said maybe you even have like cervical cancer, or they're just kind of throwing stuff out there. They hadn't come to a definitive kind of conclusion. They had done ultrasounds, they had done MRIs. They saw that the endometrium was quite thick, much thicker than it should have been. All the, certain things like that. Now, by the time she got to see me, they had already scheduled her for surgery, and they wanted to do a full hysterectomy. She was a bit of an older lady, but anyhow, even without knowing exactly what was going on, that they just figured, well, let's do a full hysterectomy. That will solve the problem. Um, by chance, she learned about our clinic, and I mean, her surgery was booked only 2 weeks away. We didn't have a whole lot of time. I didn't even have time to get her in the clinic at this point. I just spoke to her on the phone, and I started to give her some advice on some things she could start to do from a nutritional perspective. Um, Within 2 days, she called me back. She said the bleeding had stopped. Okay, now this is a woman who had been bleeding consistently for several years. Within 2 days of making some changes with her diet and all sorts of nutritional things, um, the bleeding had stopped and the pain had dramatically decreased, over 50%. Over the course of the next week, the pain was virtually gone. So now, you know, I told her, I was like, well, make sure you tell your doctors this before you go through with the surgery, because obviously something here is changing, and we don't want you to do anything that's not, absolutely necessary. So anyway, they redid repeated scans and all sorts of things, and everything appeared normal, on their scans. And now that she was, basically symptom free, she wasn't bleeding anymore, she was no longer in pain, they called off the surgery, right? Now, and we've had many other cases, women with endometriosis diagnosed, some of them not diagnosed, or just kind of suppose that, they probably do or whatever. Um, and in many, 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 many cases, we've been able to minimize medication. We've been able, in many cases, to get them off of medication, especially pain medication. There's been many cases where they were on medication but didn't seem to be working that well. And when we started working with them, it was like the medication was working better, right? So it's very possible, for a lot of nutritional factors to interfere with how medicines work. And so when we start cleaning out the diet, when we start cleaning out those factors, sometimes it's not always a matter of, getting rid of all the medication. Sometimes it's a matter of cleaning up the things interfering with how these medicines are working so that they can work the way they're supposed to work. And then you can get the real benefit from both worlds. Um, and so, that brings me to my next point. In holistic medicine, it's not an either or. It's not, either you take a natural approach or you take a pharmaceutical approach or surgical approach. They're not mutually exclusive. This is something that's really important to understand. Uh, you know, we can definitely make use of both worlds, and they go very, very well together, right? It's a shame that there's not more education about this in the mainstream. And most women never even are told or are given any kind of insight as to some of the natural things they can do, or at least told, maybe you should consider working with a holistic practitioner who can guide you with your nutrition and your lifestyle and all these types of things. Because these are things that, it doesn't matter whether it's endometriosis or any other chronic condition. These are some of the things that matter the most. Okay, so going back to the 5 root causes of disease, we're talking here about things like toxicity, okay? Toxins in the environment, toxins in your diet, okay? Toxins that are getting into your system. A lot of these we don't have a whole lot of control over, let's say like environmental pollution and things like that. But there are a lot of things that we do have control over, especially when it comes to the foods that we're eating and the water that we're drinking. Okay. A very, very simple tip I always tell people is change your drinking water immediately. If you're drinking tap water, get away from that immediately. Get yourself a filter. Okay, get yourself the best filter that you can get for yourself. Because if you don't filter your water, you become the filter. Your kidneys become the filter, and there is a lot of toxins in regular local tap water. It's a very, very simple but important thing to do. The way your cells hydrate themselves with purified water versus tap water is like night and day. A lot of people find when they're drinking tap water, it's just running through them. And there's a reason for that. Your cells do not want to absorb toxins, right? And so that water is just getting rejected very quickly. And then you're not hydrating your tissues well. This leads to congestion in the lymphatic system. And the lymphatic system plays a huge, huge role in many cases in the development of endometriosis. Okay, for those who don't know, the lymphatic system is basically the drainage pathways of the body. Okay, all the cellular waste from all the cells in the system go into that lymphatic fluid. And when that lymphatic fluid gets congested, especially in the pelvic area, this can cause adhesions, this can cause lesions, this can cause all sorts of problems that are associated with all sorts of reproductive and pelvic conditions in women. Okay, so it seems like a very, very simple thing, but you can start to get the idea of how critical a very small, simple thing is in the big picture, right? Um, so that's kind of part of the toxicity story. The other part is enhancing the detox pathways. Improving how your body metabolizes toxins, how it rids itself of toxins. This is probably the most important part because, like I said, you can't avoid all of them. There are many sources of toxins in our environment that we just can't get around. But learning how to support your body's natural mechanisms for detoxification is one of the things that you definitely have power over. Okay, so that's one. That's a very big one. The other one is the microbiome. Okay, the microbiome relates to the whole microbial environment in and around our bodies. Right. The research right now, coming from what was called the Human Microbiome Project, discovered that 90% of the cells in our body are actually microbial in nature. Okay, so for every one human cell, we have 10 microbial cells that surround it. That's huge. Okay, that's a big deal. These microbes affect every aspect of our health. They completely, influence our hormones. They influence our genetics. They influence how our body detoxifies. They influence how we digest food. They influence our immune system. 80% of the immune system is now thought to be in the form of these microbes, these bacteria, right? So this plays a huge, huge impact with the development of any disease, including endometriosis. And there's a lot more research looking into that space. So that's a very big one. From there, we have our nutrition, our diet, our nutrition, okay, nutritional deficiencies, the kinds of foods that you're eating. Very simply, I never advise people to just take supplements for the heck of taking supplements. You need to make sure that you need it. It's not going to benefit you unless you actually have a deficiency, right? So these are things that you want to work with a professional who can help guide you there. Okay, I know a lot of people, they pick up and they get swindled by all these different marketing and stuff like that, sometimes with natural products, or they just think, hey, I'll just take a multivitamin because it has everything in there, so I'll cover myself. Um, Clinically, we don't find that to be effective. And in many cases, it can cause more problems. And it's one of those things where if you're taking the wrong stuff and the wrong dosages at the wrong time, it could be one of those things that interfere with how your medication is working. So we like to take a very, very tailored approach when it comes to supplementation. We have a way of testing in a very amazing way to pinpoint exactly what a person needs when it comes to their supplementation. And we can even determine the dosages they need to be taking and what time of day they're going to benefit from it most. So this itself is a very innovative procedure that's totally non-invasive and quick and easy to do. We do it right here in the clinic. So that's a big one. Being mindful about the foods that you're eating. In general, again, we're talking about eating real food and staying away from processed food, right? That's
Shawn,
the general.
about
Anyhow, the other one is our stress and our emotional states. And then the final one is epigenetics, which is a whole topic on its own, which I won't have time to get into today. But this is something that I have a whole webinar, like I said, on my website if people are interested in learning more. That being said, that takes us to the end. Any final messages from you guys? Any take-home messages that you want to leave our listeners with?
Well, I'll just say briefly, Shawn, thank you for your very informative background on holistic treatment. You're right. We're all pieces of the puzzle and we can all come together and work together. The immune system plays a big role in endometriosis. I think it fits so nicely into the way that you treat patients. So thank you for working together. And Carolyn, any last
Yeah,
thoughts?
yeah, I just reiterate, if you're interested in what we talked about, please visit endodiagnosis.com. And you can get a hold of us by email through there. You can sign up for a wait list, everything. Shawn, thank you so much for having us. We really appreciate the chance to spread awareness about what we're doing in Canada. Thank you.
Absolutely.
Thank
Thank
you.
you guys so much.
Okay, so I'm going to stop